And we've heard and seen extremely disturbing reports of violence and intimidation outside various government hospitals. Nehawu is the National Education, Health and Allied Workers Union. They're on strike. This is despite an interdict to stop them from striking. I'm joined now by Dr. Caroline Corbett, spokesperson for the Progressive Health Forum, also president of the SA Society of Anaesthesiologists. Doctor, thank you very much for joining us. I wonder if you could just start by telling us what reports you are getting from people that you are connected to in the health industry, the level of disturbance, the sorts of things that are going on. Tell us what you're hearing.
Look, this is devastating. This is coming out of a crippled healthcare sector, recovering from the tail end of COVID, trying to get back on their feet after load shedding. We're dealing with massive backlogs of both elective and semi-urgent surgery. And now to get reports of junior staff that are having to act as scrub nurses who are highly qualified, highly skilled profession, but are not available for emergency surgeries. So we've got the equivalent of unqualified staff having to fill in for our nurses so that urgent and emergent surgeries are performed. We've got super specialized ICU techs, ICU physicians and anesthesiologists making meals for our pediatric patients who, for instance, on Tuesday morning had not been fed since Monday night. They had not had any meals, any water, any food because there was no staff to do so. We've got super specialized nursing services managers that have elected to still come on site despite threat to their lives because of shambocking, harassment, assault and intimidation, both to themselves and their families. We had a nurse wrapping corpses because we had dead patients lying next to live patients. We're not even yet sure exactly what their cause of death was because there were no staff overnight to care for these patients. Currently, as it stands, it is in many instances safer for patients to be at home than to be in hospital because of their risk. Never mind the risk to our healthcare workers who, despite extreme hostility, intimidation and assault cases happening on a daily basis, are still arriving because of their need to service patients and their commitment to patient care. And I want to take this opportunity to applaud every healthcare worker that continues to arrive at work for the greater good of patients and patient safety.
You know, it's astonishing. On the one hand, these are people whose life work is to try and save lives, to make people better. So it's, you know, the caring profession, for want of a better phrase. And yet we are hearing horrific stories from outside hospitals. In Stanger, the hospital there, the government hospital there, I spoke to a private medical service. They'd arrived with their ambulance with a young patient inside who was desperately ill. And they were stopped, admittedly not all the strikers, but there was a group within the strikers that set upon this ambulance that attacked the paramedic, pulled open the doors, and then had a confrontation with the paramedics trying to guard this little girl and save her life. They then tried to pull this patient out of the ambulance. Now, thankfully, there were people within that strike body who said, no, you've got to stop this. Plus, the paramedics were fighting them off. But as you've explained, this is already an incredibly under-resourced sector, under huge pressure. How do you understand this strike? Do you say, come on, this is just not okay? Or do you have a certain sympathy for the strikers, even though it's going haywire and very violent at times?
No, so these essential workers are integral parts of our team in the health system. Each and every one of them plays a leadership role, whether it's to stand in front of the hostile strikers and protect the patient and the paramedic, in that instance in Stanger, or whether it's to stand in a management capacity and challenge leadership at government level and say, our increase is unacceptable. We held this house up during a plague. The very least you can do is remunerate us fairly. So under no circumstances do we not support the fact that this is a reasonable protest against the underlying core of unfairness and an unreasonable approach to recognizing the sacrifice, the service, and the high skill in many instances of our essential services. What we do not support is violence, intimidation, and harm and collateral damage to our most vulnerable population. So 100%, government needs to be held accountable. We all know the failures of our leadership in this country. We are fully aware of the people that need to be standing account in front of us and saying, this is how we're going to fix it. And we understand that the history of our country often lends itself to the fact that we need to protest for people to be heard. But it is not acceptable to use vulnerable patients as collateral to negotiate a strike. It is not acceptable. And it is against the very core that we sign up for in the mandate that we take on as healthcare practitioners and essential services workers to ever use our patients and our needy population as an example to get people's attention. And there have been a number of cases where healthcare workers and essential services workers have said, this isn't the way to do it, and this isn't everybody. We have an amazing, amazing core of nurses around the country that are arriving at work, that are defending against any intimidation or harm, that are the ones locking the doors in theatre while our interns perform emergency cesarean sections because we don't have anybody else to do it. We have nurses that are bringing food parcels in. We have, porters and all sorts of cleaners and all our essential services pulling together. So this is a small core of many that are probably not even essential services workers, that are striking in the name of something that belongs in political offices, not in healthcare services.
Yeah. It's interesting. I spoke to Percy Mahlati of the Health Department, and he said, let's remember, this is a public sector strike, but they have chosen to start with the most essential sector, which is health. So health, it seems to be bearing the brunt of the entire gripe between public sector unions, not all of them, and government. But let's not forget, you mentioned politics. COSATU is an alliance with the ANC in governing this country. The health department saying to me tonight, they think it's a failure of leadership in Nehawu that you see these really violent responses within Nehawu. I put it to him, and I put it to you, this is a failure all round of leadership, from the unions to the hospital leadership, perhaps in some cases, to the health department, although not directly involved in this, to government itself.
Sally, this is a failure of human accountability as South Africans. Whether you can account for your immediate staff or your immediate system, or whether you can account for your political party or your government, take accountability, arrive and show up and take responsibility for the role that you have to play, that you're either being paid to play or you were voted into power to play, because your community is bearing the brunt of your failure. So I'm not here to be a politician. I'm a frontline healthcare worker, and I represent everybody who showed up at work today and everybody that is unhappy because their transport money is barely covered by their salary, yet they put their lives on the line during COVID to hold the house up, basically, as I said. So each and every one of us has a fundamental role in playing to keep this country on the straight and narrow and to make it sustainable. But if you're voted into power as a political party, your accountability is exponentially increased. And that is not excusable. You cannot pass the buck. You need to show up not on a Wednesday night. You need to show up on the Sunday when we know the strike is coming and we know it's going to target healthcare services that are already ailing, without power, without resources, and without any kind of financial support or political support. So I urge political parties, don't pass the buck, because us in healthcare workers, us in the front line, we're being accountable. We're showing up for work. Please show up for work, do your job, because each and every one of us is ultimately a patient. Would you want to be the one being turned away from hospital?
Mm-hmm. I want to ask you about what we know that the health minister is going to Charlotte Macleay Hospital tonight. You making the point that this should have happened on Sunday night before the strike even started. What are your expectations at the front line of what tomorrow could be like? What are the reports that you're getting? What is your advice to your colleagues and, of course, to potential patients?
Patients need to seek healthcare. So I can't give advice to somebody to be turned away from healthcare. To my colleagues, I applaud you, and I've said this, and I continue to applaud each and every person that arrives, but do not do it at the detriment to your own health. That is the antithesis of what we support. So safety first, and if your safety is threatened, you shouldn't be there. And that's when it escalates to the Safety and Security Minister and to the Minister of Defense. Previously, when we've had strikes, the military has been deployed, not to act in a security capacity unless there is violence that is not contained by the police, but to act in a healthcare service capacity. So we had an extremely functional military service that came in around the time of 2010 nursing strikes, and they serviced the communities within the hospitals. They helped us to continue to provide a bare minimum ailing basic service so that we could continue with basic ward cases, basic theatre cases, make sure that babies got born safely and mothers got home safely, that breadwinners and economically viable individuals didn't die at the hands of the healthcare system that is committed as a constitutional right to deliver healthcare. So I ask that when the health minister arrives at Charlotte Macleay, he doesn't just come with cameras, he comes with solutions. And he comes with difficult solutions that may involve bringing in additional resources while they negotiate. Negotiations can take weeks. We don't have weeks. We have emergency slates that are currently sitting, running up in 10s and 20s of numbers. These are emergency cases. That means they need to be done imminently in a surgical capacity. We have ICU patients who need to have their drains changed. We have patients whose catheter bags are full, patients who aren't being fed, patients who don't get their insulin, who are diabetic. This is really a human rights catastrophe. And I can't stress it anymore, that I don't want the minister to come with cameras and apologies. We need him to come with hardcore solutions so that from tonight, not from tomorrow, from tonight, we can deliver healthcare.
Thank you so much. You've given us such a real picture of what you call a human rights catastrophe, and action needs to be taken right now to deal with this. Thank you so much for speaking to us, Dr. Caroline Corbett, spokesperson for the Progressive Health Forum. Well,